Can we maybe start by you just telling us a bit about where you grew up and what brought you into the world of oncology?
Uh, I am a surgeon by training, and I grew up in the south of India and went to medical school in a city called Madras, then and now called Chennai. I come from a family of two doctor parents, and they were actually a team. My mom was a gynecologic surgeon and oncologist, and my father was the anesthesia for her. And they were quite academic. My mother was a big inspiration growing up in terms of her work ethic and her dedication. They both worked in the public sector in India through their entire medical career. And I did my medical school there, but came here very early for my post medical school residency and training, which I did in Health and Hospitals, New York City, at Lincoln Hospital, which is in South Bronx, and finished from Pennsylvania Hospital, which is part of the UPenn medical system. I came back and worked for a year in Cornell in surgical oncology, and then decided somehow that I would like to work in the public sector. And hence, I have been with New York City Health and Hospital for the last 23 years at Metropolitan Hospital. We are a safety net hospital in the Upper East Side or East Harlem community of New York City and belong to Health and Hospitals Corporation, which owns 11 acute hospitals in New York City system.
Dr. Srinivasan, can you tell us what a safety net hospital is?
The safety net hospital, by definition, is the commitment of a health system to provide care irrespective of your ability to pay and your immigration status and your legal status. So we do not discriminate the patient based on their coverage, insurance, their immigration status, or their legal status. And we provide the same care to all our patients, irrespective of their resources that they have in their daily life.
And given that this is a public health system, can you talk a little bit about kind of the unique challenges that you face given the mandate, the philosophy, the goal of the system?
So that's a very interesting question because why would a doctor want to serve in a public health system? And it has its ups and downs. A public health system, at least the one in New York City, is clearly the largest in the country, and it's largely supported by public funding, be it from the state or the city government or federal fund. We function like any other health system, except our medical staff is pretty much salaried. We are not based on a private practice model. And we do have incentives through faculty practice. We have academic affiliations with very prestigious medical schools like Mount Sinai, NYU, New York Medical College. But at the same time, our main commitment is to work for the city. The city provides the nursing and the administrative staff, meaning these are city workers. The doctors are pretty much a private group or they belong to a medical school affiliation. And all of us come together with the understanding that we will get any patient and we will not refuse care for the patient under any circumstance. We do focus, like any other healthcare system, on our finances, our business aspect of things, because we aim to be self sufficient and have a balanced budget. We are largely supported by a board that is appointed by the mayor of New York City. The majority of the board is an appointed board. So a lot of the funding does come through political means, which makes it a little tricky and definitely more bureaucratic. But there, I would say there is no healthcare organization that is not bureaucratic and political in nature. And that's unfortunate, but that's the reality.
Quick pause. I'm Samira, a cancer survivor. This channel shares real stories in an easy to understand fashion, guidance for the hard moments during the cancer experience. If this helps you and it helps you having us in your corner, you can subscribe for more videos like this. Now back to the show. Dr. Srinivasan, what's the $5,000 sign behind you?
That's a very interesting question, but I am proud of the fact that when I came to Metropolitan Hospital 22 years ago, we didn't have a coordinated breast cancer service. It was very disjointed. We provided excellent care. We had the resources. So I started looking at organizing a breast cancer center and getting it accredited sometime in 2015. And MINA was a small and continues to be a small breast cancer support foundation that provided us with our first check as a donation during Breast Cancer Awareness Month. I kept that check.
And what did the proceeds go to?
The proceeds are, it's unique. This is one of the challenges of a public health system. So a lot of times what happens is our patients are insured or underinsured or insured by what's called NYC Cares or a public system. And we can't get certain advanced imaging technologies to them as easily available when we are doing the workup of a patient. For example, I feel the patient's very young and I think they qualify for an MRI for evaluating extent of disease. We don't have a breast MRI coil here, and our system's MRI availability is so overwhelmed across that I am not able to get one immediately without causing delay in the workup. So if I want to send that patient outside the system or their insurance, they do have insurance, but the insurance says, no, we will not approve it, then I'm able to send that patient for a contracted subsidized amount to a private provider, which I, lobbied for. And this funding helps these patients, every one of my cancer diagnosed patients, never have to compromise on their workup. So I can get an MRI if I want to on every patient. That helps me plan their treatment in an optimal way.
Thank you for watching the Patient from Hell podcast. I started this because I wish I had something like this when I was going through cancer treatment. On this show, you will find videos and stories from real patients, real survivors, clinicians, researchers, oncologists who share their learnings, life lessons, tips, and tricks to hopefully make the cancer experience just a little easier. To find more videos and stories, you can subscribe or share this with someone you think this will help. Thank you.